The symptoms of menopause can be significant and are different for every woman. Some breast cancer treatments, like chemotherapy and drugs like tamoxifen and aromatase inhibitors, can also cause menopausal symptoms. In this episode, Associate Professor Nicholas Wilcken discusses the risks and benefits of hormone replacement therapy and explains why it's particularly important that women undergoing breast cancer treatment seek advice from their oncologist on how to best manage menopausal symptoms.
So there's been a lot of controversy about hormone replacement therapy and breast cancer, and I guess the reason that we're talking about it is because it's complicated, otherwise we wouldn't have to have a conversation. There are a lot of reasons to expect that hormone replacement therapy slightly increases the risk of a woman developing breast cancer. So it's probably a little bit much to say hormone replacement therapy causes cancer, but we could say that hormone replacement therapy might be a partial cause of some cancers. So the way we would translate that into the real world is we would say if you're going through menopause and you have a lot of very troublesome menopausal symptoms, I guess I'm thinking particularly about hot flushes and things like that, and that's really interfering with your life, then it is not unreasonable to be on some hormone replacement therapy, but the aim should be, number one, to be on the lowest possible dose that helps you, and number two, to be on it for as little time as possible. In other words, trying to wean off it after a year or two. So I think the blanket idea that you should never have HRT because that will be a disaster is going too far. However, studies have made us change our view so that 20 or 30 years ago, some people had the view that all postmenopausal women should be on hormone replacement therapy because there will be a lot of health benefits from that. And the studies that have been done have actually found that that's not the case. So it does likely slightly increase your risk of breast cancer, but it can also have impacts on other things like heart attacks and strokes and so on. So in your 50s, when you're going through menopause and you've got a lot of hassles and symptoms associated with that, that's a perfectly reasonable thing to do, but you don't really want to be on HRT for 10 years, 15 years, that sort of thing. And I guess lastly, I'd add, if you've had breast cancer, you probably do not want to be on HRT, even if you've got really bad hot flushes, but that's something that you definitely need to talk to an oncologist about. Don't make that decision on your own.
That's Associate Professor Nicholas Wilcken. Breast Cancer Trials is a group of world-leading breast cancer doctors and researchers based in Australia and New Zealand with a commitment to exploring and finding better treatments for people affected by breast cancer through clinical trials research. For more information about breast cancer trials, visit our website breastcancertrials.org.au.